So today I had my wound care rotation, and it was very interesting. I got there, and the nurses, you follow LVNs around, which the LVNs, it's kind of ridiculous that they only have the title of LVNs because of how much they do. But we went over they went over their patients for the day and figure out kind of like how they're going to organize their day, who they needed to see first, what new patients they got, because at this facility, when you're a new patient, you not only get your skin checked by the nurses that admit you, but then wound care comes and does an additional skin check. And they do it for every patient, and they will take pictures of every wound, scratch, whatever, and put it in the patient's chart. So we got all organized, and then we went about our day. The first thing I noticed we did was we went to all of the new admits and took pictures of anything that was worthy of taking pictures of. And then we went to see a patient who had a skin graft, or he had a bypass graft put in, and it ended up getting infected in his leg. So he had a tunneling wound that required a wound vac with silver because it was infected, and I learned that silver wound vacs are used when there was an actual infection present, and it's very antimicrobial, and it's really good for wound healing and also getting rid of any infection and preventing further infection. We ended up taking 12 sutures out of this guy, and the nurse let me take the sutures out, and it was the most satisfying process. Like, it was so satisfying. And then we re-bandaged him up, and his wounds were healing really well. And then we went to another patient who had 2 wound vacs on her shoulders. They were surgically, the wounds were from, she basically got sepsis and from injecting some type of cocktail in her shoulders, and it became infected, and they had to go in surgery and basically scrape off all of the infections. So she had these major, like, muscle, you could see her muscle, and both had very intense wound vacs on them, and it was pretty insane. The nurses actually double teamed, and one nurse did one side, the other nurse did the other side on the same time, so that way the pain meds were going to be good throughout the whole process of cleaning and redressing with this wound vacs on this patient. It's just a very intricate process because you need the perfect seal, and the patient handled it like a champ. I mean, she barely flinched, but it was painful. It was pretty crazy because you could see the muscles separating, and it was just super interesting to see what can happen and how long these wounds actually take to heal. Then we went, and after we checked on all of our patients and addressed any wounds or whatever, we took lunch, and then after that we did rounds with the Dr. Hamilton. She was super awesome. She did a lot of debridement on wounds, where she was using a device that basically scraped off all of the slough that was forming on each patient's wound. And obviously, pain relief was super important with this process because we wanted to make sure the patients didn't really feel it. The first patient we had, morphine was on board, and the patient did super great. She barely flinched. And the doctor was literally like just scraping everything off, and it just looked like an extremely painful situation. And this patient had like a gaping hole in her stomach, and she also had a fistula. And so the big thing with the fistula is obviously fecal matter is seeping out of the fistula and going into the wound bed. So that's not a good environment for healing. So the doctor just kind of went about her thought process on how to get this wound to be the most clean and heal the fastest way it could heal. And then we saw the next patient who had cellulitis, and it got to the point where he needed to have surgical interventions to get rid of the infection. And so she also had to do the debridement and getting off all the slop, and that was really difficult because he only had, I think, 0.7 milligrams of Dilaudid on board, which he was probably in the 400s with his weight. So 0.75 milligrams of Dilaudid isn't very much for this patient. So we got some more meds on board. We did a lot of lidocaine spray, and just the whole time as she was scraping his wound bed, he was just crying and hollering because he was in so much pain. And I tried to comfort him, but he was like, please don't talk to me. And I was like, okay, But Dr. Hamilton was awesome. She was super nice, super informative. Just a really good overall teacher. And then after that, my day was ended. But it was definitely a